Just some brief points about the scapulohumeral rhythm. It's been mentioned different times, but it is motion between the pectoral girdle or the scapula and the glenohumeral joint. They need to move together to get the large ranges of motion, such as 180 degrees of glenohumeral abduction. You need motion of the GH joint, as well as some upward rotation of your scapula. And here's just a brief a chart to kind of align glenohumeral motion with pectoral girdle motion or scapular motion. And this glenohumeral rhythm is usually 2 degrees for the glenohumeral motion for every 1 degree of scapular thoracic motion. So when we go through abduction in the frontal plane, our scapula needs to upwardly rotate and elevate. For adduction in the frontal plane, you need downward rotation and depression. For flexion in the sagittal plane of the GH joint, you need elevation and upward rotation of the pectoral girdle. For extension, again in the sagittal plane, you need depression, downward rotation, and some retraction. Internal rotation or medial rotation occurring in the transverse plane or the horizontal plane. You need protraction, which is also called abduction of the scapula. For external or lateral rotation in the horizontal plane, you need retraction or adduction of the scapula. And then for these extra motions at the glenohumeral joint, which are horizontal abduction, you need retraction and adduction. And horizontal adduction, you need protraction and abduction. And remember, the horizontal motions are as if we're doing a bench press. That's a horizontal adduction. So your scapula would protract or abduct. And horizontal abduction is kind of the down phase of our bench press, which would be accompanied by retraction and adduction. And again, you kind of need to move through these ranges of motions yourself, or palpate when a classmate is moving to kind of see the glenohumeral motion and match it to the pectoral girdle or the scapular motion.